Assalamualaikum. Today I will be presenting on concept of peptic ulcer in Unani medicine, a comprehensive appraisal. The authors are Dr. Nabilah, Abdul Aziz Rizwana, Muhammad Ali, and Feel Muhammad. This article is published in European Journal of Pharmaceutical and Medical Research in 2018. The contents of this presentation includes brief overview of the article, article information, journal information, highlights of the article, and critics. This is the brief overview of the article. The title is Concept of Peptic Ulcer in Unani Medicine, a comprehensive appraisal. It is published in European Journal of Pharmaceutical and Medical Research in 2018, and the impact factor is 4.8. ISSN number is 23943211, and the current indexing status, it is not indexed for the mid-name. European Journal of Pharmaceutical and Medical Research is a monthly international online research journal. It publishes original research paper, critical reviews, and short communications case study on the latest development in the pharmaceutical sciences and medical research. Highlights of the article includes historical background. In this article, it is mentioned that in 4th century, the first surgery of gastric ulcer was described by the Goldstein in the temple of Asclepius at Epidaurus. In 16th century, peptic ulcer disease was first established by the autopsy. In 1586, first autopsy was done by the Donatus of Mantua. 1679, Bohm concluded that inflammation of the stomach leads to the gastric ulcer. Further research goes on, and in 1704, the first known gastric hemorrhage was reported. In 1793, the first classification of stomach diseases was given by Matthew Bailey with clear description of acute inflammation, ulcer, perforation, pyloric stenosis, and ulcerated cancer. In 1817, patients with perforated gastric ulcers were reported in Dublin by Crampton, and patients with perforated duodenal ulcers were also reported in London by the Treffels. In the late 19th century, it became a popular diagnosis. In 1st century, Jalinus mentioned about Columella and its cause, symptoms, and the specific site of the ulcer. Tabri elaborated the cause, symptoms, and treatment of the Columella. Introduction of the article. The peptic ulcer refers to an ulcer in the lower esophagus, stomach, and duodenum. It can be acute or chronic. It penetrates the muscularis mucosa, but the acute ulcer shows no evidence of fibrosis. Duodenal ulcer is more common than the gastric ulcer, and about 75 to 80% of the peptic ulcer are found in the duodenum. It is highly associated with H. pylori, 70%, and about 30% is associated with erysipelas. The risk factors in this paper is mentioned as cigarette smoking, coffee, tea, and colas. And we will talk about its presentation. It is firstly presented by the pain, and this pain is felt in the epigastrium region. It is associated with the episodic occurrence, and it is related to the food. Talking about the Nani concept of the peptic ulcer, in this article, it is mentioned under the term parahypnismia. Parahypnismia is described under the entities of parahypnomary, ulcer of the esophagus, parahypnomary, gastric ulcer, and parahypnomary, intestinal ulcer in the different classical texts of the Unani medicine. There are 4 natural types of the meta. Hard, Bharat, Yabis, Radha. These are the lizards of the temperament of the stomach. The original lizard of the stomach is hot and moist, as it is a muscular organ. Talking about the idiopathogenesis in Unani, the article or the author has mentioned about this way lizard Sada and Mati due to this with the teeth, and third they have mentioned about the Tafurta episode. when there will be the accumulation of morbid plaque, it will first alter the function of the stomach. It will lead to the visage alteration, that is the visage. It will also causes with the teeth, and at last, the further itself, that is the loss of the discontinuity of the mucosal alteration. Causative factors they have mentioned Hilde-Hadelaze, which is produced in the stomach itself or received from other organ like brain, liver, and spleen. If it is if it is caused due to the brain, the film will be involved will be welcome. In liver, bile will be involved, and in spleen, black bile is involved. The ingestion of acids and spicy like vinegar, it will lead to the formation of ulcer in the stomach. The third causative factor is the consequence of the inflammation. There will be inflammation, then lactic ulcer disease can happen. Clinical features: bad smell from the mouth and belching, dryness of the palate and tongue, frequent vomiting, ulcer debris is expelled along with the vomiters. They have also mentioned the differential diagnosis in between the Karahi-Mari, Karahi-Medi, and Karahi-Medi. Karahi-Mari में pain is felt between the shoulders. It is felt in neck during the passing of the food, and it disappears after the passage of the food. In Karahi-Medi, pain increases with passing of the food from the stomach, and it is spread near the navel, and the patient will have shallow breathing, dryness of tongue, fullness of vessel, foul smell, belching. In Karahi-Medi, pain increases while passing of the food, and it is felt below the navel. Presence of levels of ulcer is found in the feces. They have mentioned the treatment according to the type of the ulcer. They have mentioned some simple drugs, compound drugs, and its prevention by the diet. Conclusion of the article is that peptic ulcer disease is the major health problem in both developed and developing countries. There are a number of modern medicines available for this condition, but adverse effects and high cost are the major limitation for the use of these drugs. At this point in time, Unani system of medicine is quite feasible mode of treatment option to cure this condition. Hence, the Unani system of medicine has its unique way of treatment, provided the prescribed diet regimen, and it is followed along with correct use of single and compound preparation. Coming to the critics. The journal and article in which the publisher is mentioned, publishing information is given, all the revised, received and accepting dates of the article is mentioned, and critic is given. Title of the study is relevant, self-explanatory, easily understandable. Author's information explains our name and affiliation of the author is given. Also the corresponding author's names and affiliation is also given. And the critic is email address of the authors and corresponding author is not given. In abstract, it is structured within the prescribed word limit. It is informative and keywords are also mentioned. In critic's objective is not mentioned. Introduction, the strength that Unani concept is well structured in the form of the interdependencies, causative factors, clinical features, differential diagnosis, principle of treatment, prognosis, and as well as prevention. It is informative. Critics, there is ample room for exploration of the modern pathology, and they have not mentioned figures which represent the morphological features, as it would have given a better picture of correlation with the Unani concept. Conclusion, they have focuses on the Unani medicine in terms of the treatment, and using of Unani drug is more feasible and effective as compared to the modern medicine. All the references are consequently in the order in which they are mentioned in their text. Latest is 2012 and oldest is 1987. The personal impact what have I gained is it can be used for a reference. It is an average paper. And the language of the paper is simple and understandable. Thank you.